Early detection of health problems. Health assessments can help identify health problems before they become more serious. Early detection can increase the chances of successful treatment and prevent progression of a condition.
Patrick will be having his final examination tomorrow, and it's been weeks of lack of sleep and poor diet because he keeps on reviewing for his major courses. But at school, he suddenly feels severe headache and lost his consciousness.
Yo, what's up, bro? You're finally here. How are you? I'm sure they'll give you for the exam.
Wait, bro. My head hurts so
Oh my
bad.
God, are you okay?
I feel dizzy, bro.
Oh, oh my God! You're back!
Nurse Michelle, the school nurse, will now perform a health assessment to Patrick in order to determine if there are health problems and have an early detection before it becomes serious.
Oh, Kuya Pat is awake. Nurse!
As soon as his eyes were open, Nurse Michelle checked Patrick's oxygen saturation with the oximeter, and she noticed that his skin and lips were pale, as well as the color of conjunctiva is not normal.
How's Kuya Pat?
Consulting now. May I ask, do you stay up late this past few days?
Yes, I need to review my examination.
Do you skip meals?
Yes.
You might be experiencing signs of anemia, which I suggest you to see a physician before it will lead to serious illness.
What does it mean?
To help diagnose, the doctor will order a blood test to check the patient's complete blood count or CBC, hemoglobin levels, blood iron levels, and ferritin levels. The doctor may tell the patient that the iron level in one's blood is low. The doctor may also tell to the patient that he or she might have an anemia with iron deficiency.
Is it good that you have taken to the clinic immediately so that we can detect any complication? However, I observed that your skin and lips are pale. It might be because of your lack of sufficient iron. Yes, that you take ferrosulfate, but is it better that you consult your doctor? Preventive care. Health assessment can help identify risk factors for disease and conditions, which can help healthcare providers recommend preventive measures to reduce the risk of developing these health problems.
The next day, Patrick went to his physician, Dr. Kayla Baluyot. Then she assessed again Patrick to either confirm or reject Nurse Michelle had said about Patrick's condition.
So may I ask, are you staying up late this past few days?
Yes, I did, doc. I need to review for my examinations.
Do you skip meals?
Yes, doc.
Do prescribe that you should take ferrosulfate to prevent anemia that may cause more serious complications such as fatigue, headaches, restless leg syndrome, and heart problems. Iron deficiency anemia is preventable only if you will maintain a healthy diet that includes good sources of iron and vitamin C. Do you understand?
Yes, doc.
Remember to have enough sleep and rest, do some exercise, and have a balanced diet. Prevention is much better than cure, but to make sure, we will have your monthly checkup. Before parting ways, do you have any concerns?
I don't have, doc.
Okay, then get well and always monitor your health status.
Thank you so much.
Monitoring health status. Health assessment can help healthcare providers monitor changes in a patient health status over time. This allows for early detection of changes that may indicate the development of a health problem.
After a month, Patrick go to the hospital for his monthly health assessment checkup, but Lian called him to ask him to eat with her and Mont in Samgyeopsal as they celebrate Miguel's birthday, but he refused because of the said schedule.
Hey Kuya Pat, I'm with Mon today.
Hi! What's up, Lian?
Will you be able to attend Miguel's birthday today?
Sorry, but I can't. I'm here at Mount Carmel Hospital for my monthly health assessment. But I might join you later, guys.
Health assessment? Why would you need a health assessment? You're the healthiest person I know.
Your monthly assessment is essential for even if you don't have any kind of disease or illness.
Oh, okay. I see. I'll schedule my health assessment soon.
See you, Kuya Pat!
See you!
Bye, guys.
After the call, Patrick now went to his doctor for his monthly health assessment checkup.
Hi Patrick, how do you feel well now since it's your last visit?
I feel very well, Doc.
That's a great news. Now we will start again by taking your vital signs such as your blood pressure, oxygen saturation, and respiration. After that, we will go through a few questions about your overall health and any concerns you may have. Is that okay with you?
Yes, Doc, that sounds good.
Dr. Kyla now proceeds to take Patrick's vital signs and ask him a series of questions about his health, such as his diet, exercise routine, sleep patterns, or any symptoms he may have experienced since his last visit.
Based on what you've told me, it seems like you're doing well overall. However, I did notice that your blood pressure is slightly lower than last time and we will need to keep an eye on it. I'd like to schedule a follow-up appointment in a few months to monitor your blood pressure again. Does that work for you?
Yes, Doc. Sure, I can do that.
Before we wrap up, do you have any questions or concerns you'd like to discuss?
Yes, Doc, I have been having some trouble sleeping lately. So do you have any recommendations?
There are few things that we can try, such as improving sleep, hygiene, or considering a sleep aid. I'll provide some resources for you and we can discuss it further at your next visit.
Improve communication. Health assessment provide a opportunity for patient and healthcare providers to communicate openly about health concern, medical history, and treatment options. This can improve the quality of care and patient process.
Patrick never missed any of his monthly checkups, which made him healthier, and his vital signs were now all in good conditions. While Frances, a new patient, went to Dr. Kyla for her monthly health assessment checkup.
I was diagnosed with insomnia 2 months ago, Doctora, yet there's still no improvements when it comes to my sleeping routine.
Insomnia. It is a common sleep disorder. With insomnia, you may have trouble falling asleep, staying asleep, or getting good quality sleep. This helps even if you have the time and the right environment to sleep well. Insomnia can get in the way of your daily activities and may make you feel asleep during the day.
Are you consistent with your bedtime and wake time every day?
No, Doc.
Do you exercise at least few minutes before your bedtime?
No, Doc.
Are you drinking the prescribed melatonin supplements I have prescribed you for the last 2 months?
No.
Then that concludes why you're not feeling better than the last time. I hope you do these things regularly starting now in order for you to feel better. Be aware for your sleeping and wake up routines.
Okay, Doc. Sorry for not following your instructions.
I understand that you might be having a hard time on adjusting, but in order to be healed, you must follow your doctor's advice. Okay?
Yes, Doctora.
Personalized care. Health assessment provide an opportunity for patient and healthcare providers to communicate openly about concerns, medical history, and treatment options. This can improve the quality of care and patient outcomes.
The College of Our Lady of Mount Carmel, Pampanga, has conducted a seminar for BS Nursing about health assessment on personalized care. The guest speaker was Dr. Roteza.
Good morning, everyone. I would like you to meet Dr. Roteza from COMC Hospital.
Hello everyone, I'm Dr. Roteza. For today, I'm going to do a seminar about insomnia. Shall we start? So first, what is insomnia? Insomnia is a common sleep disorder. If you have it, you will have trouble falling asleep, staying asleep, or both. As a result, you may too little sleep or you have a poor quality sleep. You will not feel refreshed when you wake up.
Dr. Roteza will now answer your question.
Is insomnia a mental disorder or not? Insomnia is rarely isolated medical or mental illness, but rather a symptoms of another illness to be investigated by person and their medical doctors. In other people, insomnia can be result to be of a person lifestyle or work schedule. Yes?
Is insomnia a type of depression?
There is definite link between lack of sleep and depression. In fact, one of the common signs of depression is insomnia or an inability to fall and stay asleep. Let's not say insomnia or other sleep problems can caused only by depression. Yes?
What is the best treatment, Doc?
There are those basic tips to treat the insomnia. The first one is stick to sleep schedule. Keep your bedtime and walk time consistent from day to day, including weekends. Stay active, check your medications, avoid or limit naps, or it's either avoid or limit caffeine and alcohol. Don't use nicotine. Don't put it with pain. And the last is avoid large meals before bedtime.
You learned something from the discussion and I hope that you can apply it to yourself. Once again, on behalf of the College of Our Lady of Mount Carmel, thank you for your time.